What is lupus? Lupus is a disease that occurs when your body's immune system attacks your own tissues and organs. It is an autoimmune disease. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cell, brain, heart, and lungs. Lupus can be difficult to diagnose because its signs and symptoms often mimic those of other ailments. The most distinctive sign of lupus, a facial rash that resembles the wings of a butterfly unfolding across both cheeks, occurs in many but not all cases of lupus. Some people are born with a tendency toward developing lupus, which may be triggered by infections, certain drugs, or even sunlight. While there's no cure for lupus, treatments can help control symptoms. Symptoms of lupus. No two cases of lupus are exactly alike. Symptoms and signs may come on suddenly or develop slowly, may be mild or severe, and may be temporary or permanent. Most people with lupus have mild disease characterized by episodes called flares, when signs and symptoms get worse for a while, then improve or disappear completely for a time. These signs and symptoms of lupus that you experience will depend on which body systems are affected by the disease. The most common signs and symptoms include fatigue, fever, joint pain, stiffness and swelling, butterfly-shaped rash on the face that covers the cheeks and bridge of the nose, or rashes elsewhere on the body, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, or memory loss. When to see a doctor. See your doctor if you develop an unexplained rash, ongoing fever, persistent aching, or fatigue. Causes of lupus. As an autoimmune disease, lupus occurs when your immune system attacks healthy tissue in your body. It's likely that lupus results from a combination of genetics and environment. It appears that people with inherited predisposition for lupus may develop the disease when they come into contact with something in the environment that can trigger lupus. The cause of lupus in most cases, however, is unknown. Some potential triggers include sunlight. Exposure to the sun may bring lupus skin lesions or trigger an internal response in the susceptible people. Infections. Having an infection can initiate lupus or cause a relapse in some people. Medications. Lupus can be triggered by certain types of blood pressure medications, anti-seizure medications, and antibiotics. Some people have drug-induced lupus usually get better when they stop taking the medication. Rarely, symptoms may persist even after the drug is stopped. Risk factors. Factors that may increase your risk of lupus include your sex. Lupus is more common in women. Age. Although lupus affects people of all ages, it's most diagnosed between the ages of 15 and 45. Race. Lupus is more common in African Americans, Hispanics, and Asian Americans. Complications. Inflammation caused by lupus can affect many areas of your body, including your kidneys. Lupus can cause serious kidney damage, and kidney failure is one of the leading causes of death among people with lupus. Brain and central nervous system. If your brain is affected by lupus, you may experience headaches, dizziness, behavior changes, vision problems, and even strokes or seizures. Many people with lupus experience memory problems and have difficulty expressing their thoughts. Blood and blood vessels. Lupus may lead to blood problems, including a reduced number of healthy red blood cells or anemia, and an increased risk of bleeding or blood clotting. It can also cause inflammation of the blood vessels. Lungs. Having lupus increases your chance of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into lungs and pneumonia are also possible. Heart. Lupus can cause inflammation of your heart muscle, your arteries, or your heart membrane. The risk of cardiovascular disease and heart attacks increase greatly as well. Other types of complications. Having lupus also increases your risk of infection. People with lupus are more vulnerable to infection because both the disease and its treatments can weaken the immune system. Cancer. Having lupus appears to increase your risk of cancer, however, the risk is small. Bone tissue death. This occurs when the blood supply to a bone declines, often leading to tiny breaks in the bones, and eventually the bones collapse. Pregnancy complications. Women with lupus have an increased risk of miscarriage. Lupus increases the risk of high blood pressure during pregnancy and preterm birth. To reduce the risk of these complications, doctors often recommend delaying pregnancy until your disease has been under control for at least 6 months. Diagnosis of lupus. Diagnosing lupus is difficult because signs and symptoms vary considerably from person to person. Signs and symptoms of lupus may change over time and overlap with those of many other disorders. No one test can diagnose lupus. The combination of blood and urine tests, signs and symptoms, and physical examination findings leads to the diagnosis. Laboratory test. Blood and urine tests may include complete blood count. The test measures the number of red blood cells, white blood cells, and platelets, as well as the amount of hemoglobin, a protein, in red blood cells. Results may indicate you have anemia, which commonly occurs in lupus. A low white blood cell or platelet count may occur in lupus as well. Erythrocyte sedimentation rate. This blood test determines the rate at which red blood cells settle to the bottom of the tube in an hour. A faster than normal rate may indicate a systemic disease such as lupus. The sedimentation rate isn't specific for one disease. It may be elevated if you have lupus, an infection, another inflammatory condition, or cancer. Kidney and liver assessment. Blood tests can assess how well your kidneys and livers are functioning. Lupus can affect these organs. Urinalysis. An examination of a sample of your urine may show an increased protein level or red blood cells in the urine, which may occur if lupus has affected your kidneys. Anti-nuclear antibody or ANA test. A positive test for the presence of these antibodies produced by your immune system indicates a stimulated immune response. While most people with lupus have a positive ANA test, most people with a positive ANA do not have lupus. If you test positive for ANA, your doctor may advise more specific antibody testing. Imaging tests. If your doctor suspects that lupus is affecting your lungs or heart, he or she may suggest chest X-ray. An image of your chest may reveal abnormal shadows that suggest fluid inflammation in your lungs. Echocardiogram. This test uses sound waves to produce real-time images of your beating heart. It can check for problems with your valves and other portions of your heart. Treatments for lupus. Treatments for lupus depend on your signs and symptoms. Determining whether you should be treated and what medications to use requires a careful discussion with the benefits and risks of your doctor. As your signs and symptoms flare and subside, you and your doctor may find that you'll need to change medications or dosages. The medications most commonly used to control lupus include non-steroidal anti-inflammatory drugs or NSAIDs. Over-the-counter NSAIDs such as naproxen sodium Aleve and ibuprofen like Advil, Mortrin IB, and others may be used to treat pain, swelling, and fever associated with lupus. Stronger NSAIDs are available by prescription. The side effects of NSAIDs may include stomach bleeding, kidney problems, and an increased risk of heart problems. Anti-malarial drugs. Medications commonly used to treat malaria, such as hydroxychloroquine or Plaquenil, affect the immune system and can help decrease the risk of lupus flares. Side effects can include stomach upset and very rarely damage to the retina of the eye. Regular eye exams are recommended when taking these medications. Corticosteroids. Prednisone and other types of corticosteroids can counter the inflammation of lupus. High dosages of steroids such as methylprednisolone, Medrol, are often used to control serious diseases that involve the kidneys and brain. Side effects include weight gain, easy bruising, thinning bones, high blood pressure, diabetes, increased risk of infection. The risk of the side effects increases when higher doses and long-term therapy applies. Immunosuppressants. Drugs that suppress the immune system may be helpful in serious cases of lupus. Examples include azathioprins like Imuran and Azasan, mycophenolate like Cellcept, methotrexate like Trexol, Satmep, and others, cyclosporin like Sandismune, Neural and Gengraf, and leflunomide like Arava. Potential side effects may include an increased risk of infection, liver damage, decreased fertility, and an increased risk of cancer. Biologics. A different type of medication, belimumab Benlysta, administered intravenously, also reduces lupus symptoms in some people. Side effects include nausea, diarrhea, and infections. Rarely worsening of depression can occur. Rituximab, like Rituxan and Truxima, may be beneficial for some people in whom other medications haven't helped. Side effects include allergic reactions to the intravenous infusion and infections. In clinical trials, voclosporin has been shown to be effective in treating lupus. Other potential drugs to treat lupus are currently being studied, including abatacept, like Orencia, anifrolumab, and others. Lifestyle and home remedies. Simple measures can help you prevent lupus flares, and should they occur, better cope with the signs and symptoms you experience. Try to see your doctor regularly. Having regular checkups instead of only seeing your doctor when your symptoms worsen may help your doctor prevent flares and can be useful in addressing routine health concerns, such as stress, diet, and exercise that can be helpful in preventing lupus complications. Be sun smart. Because ultraviolet light can trigger a flare, wear protective clothing such as a hat, long-sleeved shirt, and long pants, and use sunscreen with sun protection factor SPF of at least 55 every time you go outside. Get regular exercise. Exercise can help keep your bones strong, reduce your risk of heart attack, and promote general well-being. Don't smoke. Smoking increases your risk of cardiovascular disease and can worsen the effects of lupus in your heart and blood vessels. Eat a healthy diet. A healthy diet emphasizes fruits, vegetables, and whole grains. Sometimes you may have dietary restrictions, especially if you have high blood pressure, kidney damage, or gastrointestinal problems. Ask your doctor if you need vitamin D and calcium supplements. There is some evidence to suggest that people with lupus may benefit from supplemental vitamin D. A calcium supplement can help you meet the daily recommended dietary allowance of 1,000 milligrams to 1,200 milligrams depending on your age to help keep your bones healthy. Coping and support. If you have lupus, you're most likely to have a range of painful feelings about your condition, from fear to extreme frustration. The challenges of living with lupus increase your risk of depression and related mental health problems such as anxiety, stress, and low self-esteem. To help you cope, try to learn all you can about lupus. Write down any questions as they occur to you so that you can ask them at your next appointment. Ask your doctor or nurse or other reputable sources for further information. The more you know about lupus, the more confident you'll feel in your treatment choices. Gather support among your family and friends. Talk about lupus to your family and friends and explain ways they can help out when you're having flares. Lupus can be very frustrating for your loved ones because they usually can't see it and you may not appear sick. Family and friends can't tell if you're having a good day or a bad day unless you tell them. Be open about what you're feeling so that the loved ones can know what to expect. Take time for yourself. Cope with stress in your life by taking time for yourself. Use that time to read, meditate, listen to music, or write in a journal. Find activities that calm and renew you. Connect with others who have lupus. Talk to other people who have lupus. You can connect through support groups in your community or through online message boards. Other people with lupus offer unique support because they're facing many of the same obstacles or frustrations you are facing. In the end, make sure to share your experience with us and don't forget to subscribe, share, and like.